Thompson. Owen Thompson.
Thank you, Mr Paisley. It's a pleasure to serve under your chairmanship. And I would congratulate my honourable friend, the member for East Kilbride, Straven and Lesmahago for bringing forward this debate today. I think it is important that we do give a focus to mental health, and it's a great opportunity to do that today. I know that she brings a wealth of invaluable professional experience to the topic that I can't even begin to try to understand. Mental health is, like other aspects of our health, it needs dedicated time to take care of, to look after, if we were to reduce the chances of getting seriously unwell. If we relentlessly push our bodies in every single day, we soon pick up physical ailments, stresses, strains, and these could develop into something more serious if not given time to recover. Our bodies will send signals telling us to stop before we collapse. The same goes for our minds. Downtime is not a luxury, it's essential, and we all need to be able to read the signs before reaching breaking point. The brain is unbelievably complex as an organ, and it's constantly processing something even more complex, human experiences and emotions. I'm amazed that it doesn't go down and something doesn't go wrong with it more often than it actually does. On the front line, our carers and health staff have faced the brunt of the pandemic response. We may moan about working from home or not being able to go to the pub or to see friends, but they see people scared, alone, in pain, gasping for breath. They see families unable to get close enough to offer their loved ones the most basic human comforts, a hug. Dealing with that every day takes its toll. And the World Health Organization have reported a recent review of healthcare professionals finding 1 in 4 suffering from depression and anxiety, and 1 in 3 had insomnia during the coronavirus outbreak. There was also an appalling rise in verbal harassment, discrimination and physical violence, and no wonder they're battle-scarred. Switching off from work is made even harder by the fear of being a spreader, which leads to increased isolation, and what we need is social comfort and community. Like all of us, frontline staff can't access the habitual escape routes that we used to take for granted, whether that be going out for a drink with friends, to theatre, live music, or the warmth and incitement of the crowd at a football match. These things aren't possible just now. So with NHS resource cut by years of austerity, staff were already working at or beyond capacity before this pandemic, so they had to find a whole new superhuman reserve of energy when the crisis struck. Sheer willpower, determination and dedication keep the staff going, and I can't thank them enough for that. But after 8 months with no end in sight, more and more of our critical staff are getting to breaking point, traumatised, running on empty, and mentally as well as physically exhausted. In these serious circumstances, it's essentially the responsibility of government to make sure adequate levels of professional mental health support are in place. We need more than a website or an app and a few choicely worded paragraphs in a staff handbook, although all sources of information are very welcome. It's every port in a storm, I suppose you could say. We need more trained psychologists and counsellors available to provide tailored support, human faces with experience and expertise in their field. We need to make sure people are able to talk and share experiences with others, to be listened to get a bit of breathing space and be guided to help get more help and treatment wherever they can't cope. I know the NHS in England, like the Scottish Government, brought in helplines to help staff dealing with COVID-19, and I welcome those efforts. The Scottish Government has also established the National Wellbeing Hub in May for health and social care staff, which takes a psychological first aid approach, with resources on self-care and 1,000 hours of coaching for staff to maintain health, well-being and resilience. I believe this is a first of its kind in the UK, and I know from the feedback that I've had, it's been a very welcome move. I am pleased to see that the National Wellbeing Hub includes a section for unpaid carers, because the Carers Trust found that 68% of young adult carers in Scotland said their mental health was worse as a result of coronavirus, and 85% were worried about their own futures. These 12 to 17-year-olds who already have responsibilities beyond their years, living in an age of anxiety and unimaginable when all of us in this room were of their age. I recently hosted a virtual meeting with young people in Midlothian to talk about their own lockdown experiences and concerns, and it was deeply worrying just how many issues they raised and how many issues that were related to their own mental health and how little they felt listened to by so many in power. Health and Safety Matters reports, a survey into mental health of frontline staff and healthcare professionals, revealed that over 90% believe there's not enough mental health support available for the general public to deal with the aftermath of the pandemic, and 66% felt there's not enough workplace support for healthcare professionals and frontline staff. We rightly call our frontline workers heroes, and we admire their courage and dedication, but those in government need to look after them and not just praise them. It's good to see carers and who some in this government have insultingly called low-skilled, getting the recognition they deserve. But in fact, most key workers don't have a choice but to keep going. They would rather not risk their mental or physical health for a care badge or a clap. They should be proud of their jobs, but pride doesn't pay the bills, or doesn't keep them and their loved ones safe. I would suggest that the best way and the best thing for the government to do would be to find an appropriate way of honouring these heroes in our NHS, care sector and essential services who work tirelessly day after day to defeat coronavirus and look after all the rest of it.